Hi,
Hello,
how are you doing today?
I'm good.
All right, my name is Aldana. I'm going to be your nurse practitioner today, and we're just going to do a comprehensive physical exam. We will start with one body system, probably with your head and go down.
Okay.
Can you just answer a couple of quick questions for me?
Sure.
What's your name?
Sarah,
All right, Sarah, and what is the date today?
July 22nd,
It sure is. And when's your date of birth?
November 18th.
Okay, perfect. And where are you today?
Here at the clinic.
You sure are. Alrighty, so we're gonna go ahead and start. I'm gonna first start off by inspecting your hands. I'm gonna just kind of look at your skin and your capillary refill and your finger and nail beds. Everything looks fantastic. I'm gonna have you turn around and squeeze my hands. Perfect. And I'm gonna go ahead and have you make a fist. I'm gonna have you flare out your fingers as wide as you can. Put them back together. I'm gonna have you turn your wrists in, turn your wrists out, turn your wrists up and down. Perfect. That looks really good. Next, I'm gonna have you put your arms up like this. I'm gonna have you turn your, extend your arms. I'm gonna have you turn your elbows in, elbows out. Perfect. Next, take one of your hands, put it on your chest, and then you're gonna pull it across your body, up and over towards the your back. Perfect. Any pain with that?
Nope.
And I'm gonna have you do the same with the other. So up across your body and to the back. Perfect. No pain with that either? Good. Then have you take one of your hands and reach back and touch your brush back. Sorry. Next one, the same with your other hand. Touch back. Perfect. No pain with that either? Perfect. Other than that, I think we're done with your arms and hands. We're going to go ahead and we're going to move towards your head. So I'm going to go ahead and I'm going to actually sanitize my hands first. Now I'm going to go ahead and feel your scalp, any issues with your hair or any bumps, lumps, anything like that. Nope. Alright, I'm going to go ahead and feel your lymph nodes. So it's your occipital, your post-auricular, pre-auricular, you have your tonsillar, your submandibular and submantle. We have your posterior cervical right here, and then you have your anterior cervical and your supraclavicular, which all feel just fine. I'm going to go ahead and feel your thyroid as well, so you're going to feel me pushing on your neck. Nothing going to push back. That looks good. I'm going to move my fingers up and I'm going to check your TMJ. So I'm going to have you clench your jaw. Good. That's very good. That's your masseter muscle. And then I'm going to have you open your jaw up and close. Good. I'm going to move up to your temporal artery. They feel fine. There's nothing there. So I'm going to go ahead and do a little test. We're going to be checking your sensitivity on your face. See if you can differentiate between sharp and dull pain. Okay. Or touch. So this is what the dull should feel like, and this is sharp, okay? So close your eyes. There you go. Better?
Yeah,
okay. So this is, close your eyes. So this is soft. Sharp.
Soft.
Sharp. Good job. I'm going to go ahead and I'm also going to palpate your frontal sinuses. Does that cause any pain?
No.
And your maxillary? Any pain with that? No. Okay. I'm going to have you raise your eyebrows up, wrinkle your forehead. Good. I'm going to have you close your eyes real tight. I'm going to have you puff out your cheeks. Good. I'm going to have you smile for me real big. Perfect. Perfect. While I'm in that general area, I'm going to have you stick out your tongue and say, ah. Good. All right. Uvula's midline, and it looks good. Your buccal cavities look great. I'm going to have you stick out your tongue, and this is just checking for range of motion. So stick it up, down, side, and side. Good. Good. Okay. I'm going to use my trusty little pen light right here, and I'm going to look up your nose and just see what that looks like. Okay. Right leg. All right, your septum's midline looks good. I don't see any trauma. I'm going to go ahead and move to your eyesight. So you just look straight at me. I'm going to shine a bright light in your eye. All right, perfect. Other side. Good. All right, that looks really, really good. Over in this area, I'm going to go ahead and check your visual, do a visual test for you. Okay. I'm going to have you hold this card. and it's about 14 inches out in front of you. Cover your left eye, and I'm gonna have you read the lowest line that you can read.
4, 2, 6, 7, 3, 8.
All right, good. You got all of them? And then cover your other eye.
4, 2, 6, 7, 3, 9.
Did you say 9 in the last one?
No, I said 8.
Oh, I'm sorry.
Mhm.
That was 1. I thought you threw me out. Well, because that's hard to see for
I
me.
know.
All right, that was 1. So on your 20 minus 1 on your left eye and 20 on your right eye. And then all together,
4, 2, 6, 7, 3, 9.
all right, that's 20. Tricky. All right, so past that, we're gonna go ahead and check your visual fields. So I'm gonna have you cover your right eye, and I'll cover my left, and then you tell me whenever you see my fingers wiggling, okay?
Now. 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 Now.
Okay.
Now. Now. Now.
Good. We're gonna do the same with your opposite eye, okay?
Now. Now. Now.
All right, and then this side.
Now. Now. Now.
Good, you're very good at that. All right, I'm gonna have you look behind me, and then you're going to look at me, and then follow my finger towards your nose. All right, good. Just checking for a pupillary response. Excellent.
Great.
The other thing I'm gonna do is check for your ocular movements. So I'm gonna have you follow my fingers,
Okay.
and not with your head, just with your eyes. Perfect. That was so great. All right, I'm gonna get my little trusty friend out over here, and we're gonna go ahead and check your pupils from the side. Okay. Also look just straight past my shoulder. Perfect. So let's take the other side. That looks good. Okay. Leave that alone. I'm gonna get my other friend out, and we're gonna go ahead and check your ears, okay?
Okay.
First, I'm gonna go ahead and I'm going to see if you can hear my fingers.
I can?
Okay? I'm checking the other side.
Yes.
Alright, perfect. Now we're gonna go ahead and I'm gonna pull back on your ear, and you tell me if that causes any pain.
No.
And look inside. That looks really good. And check the other one. Same thing, I'm gonna pull back. Do you feel any pain?
No.
That's really good. Alright, last I'm gonna go ahead and I'm gonna check your head motions. So I'm gonna have you turn your head to one side, the opposite, now up, down, and I'm gonna have you tilt your head towards one shoulder, tilt to the other. Any pain with any of that? Nope. I'm gonna have you shrug your shoulders, push against me. Alright, perfect. Alright, now we're gonna go ahead and move on down. I'm gonna go ahead and I'm gonna start by listening to your lungs first. So just breathe normally. Sounds really good. Sounds good. I'm gonna go ahead and I'm gonna have you say 99.
99.
99, okay?
99.
One more time.
99.
Alright, good. And we're gonna go ahead and percuss. You'll feel me kind of hitting my fingers above your body. That sounds really good. Alright, so and all of that, we're gonna go ahead and we're gonna move to your back, and I'm gonna take a listen. This time, take a deep breath when you feel my stethoscope move, okay?
Mm-hmm.
Sounds really good. Once again, say 99.
99,
One more time.
99,
One more time.
99.
Alright, that sounds good. I'm gonna feel down your spine. Does that all feel okay?
Mm-hmm.
It looks good, it's straight. I'm gonna go ahead and start percussing.
Okay.
And you tell me if me percussing here causes any pain, okay?
Okay. Okay.
Does that feel alright too?
It does.
Alright. That all looks really good. I'm gonna have you lay on back. Go. Alright. I'm gonna go ahead and I'm gonna shine a bright light onto your neck just to check for your vasculature and make sure you don't have any jovial distension. So I'm gonna have you turn your head to the side real quick. Okay, that looks really good. There's no distension and I see good pulse. I'm gonna go ahead and I'm going to palpate your carotid arteries. Good. So I'm gonna go ahead and listen to them. I'm gonna go ahead and move down. I'm gonna just listen to your heart sounds and your belly, okay?
Okay.
Good. And I'm gonna have you just twist your upper body a little to that side. Good job. Alright, perfect. Sticking on back. Okay, I'm gonna go ahead and listen to your aorta and your renal arteries and your femoral. Bowel sounds, excellent. Oh, actually, let's do your bowel sounds too. While I'm down here. Good. Alrighty, we're gonna go ahead and we're gonna just kind of feel down, make sure everything looks okay. I'm gonna feel it for your PMI. Looks good. Gonna do some light palpation. You let me know if anything hurts, okay?
Okay.
We're gonna do a little deeper palpation. Checking. Once again, let me know if anything hurts. Any sharp pain.
Mm-mm.
Gonna have you take a big deep breath in. Alright, exhale. Okay, good. And then one more time, big deep breath in. Exhale. Perfect. Now I'm gonna go ahead and I'm going to palpate your femoral artery. Good. Good. And then your inguinal. Perfect. I'm gonna go ahead and percuss. That all sounds pretty good to me. We're gonna move on down, and we're gonna go ahead and do some range of motion and see how flexible and everything looks down here.
Okay.
So, looking at your skin, looks good. Everything looks great. There's no ulcers. Gonna go ahead and take off your shoes if you don't mind. Okay, I'm gonna feel your pedal pulses. Real good. Posterior tibialis. Fantastic. I'm gonna go ahead and pull against my fingers. Push. Good. And push down. Perfect. Alright. I'm gonna have you do some range of motion, see where we're at. So I'm gonna go ahead and lift your knee up. Perfect. And then you're going to lay it out. Perfect. And then back and then down. And then we're gonna do the same with this one. Up, out, perfect. Any pain with any of that?
No.
Okay. I'm gonna go ahead and have you bring your leg out laterally. Good job. Any pain with that? No. Alright, one more. Good job. Perfect. Now I'm gonna go ahead and have you take your left leg, the heel of your left leg, and go along the shin from your knee to your ankle or otherwise. Perfect. And now with your other leg. Good job. Perfect. Okay, you can relax that. I'm gonna take this, it's a little sharp. I'm gonna go from your heel upwards to your toes. Alright, good. Good. Alright. Perfect. As far as your legs, I think that's that. Alright, I'm gonna go ahead and help you sit on up. Alright, perfect. We're gonna start off on, I'm gonna push down, you push up. Perfect. Push out. And then push down. Alright, good job. We're gonna do a couple of silly things before we start on your reflexes. I'm gonna have you lay your hands flat on your thighs and then flip them over and keep doing that as fast as you can. Perfect, that looks really good. I'm gonna have you put your hands out like this, and then I'm gonna have you touch each finger to your thumb and keep doing that. Perfect, that looks excellent. Okay, and then the last one, I'm gonna have you put your index finger to your nose and then touch to my finger and then to your nose, back and forth. Now close your eyes and keep doing it. Perfect, open your eyes, and now you're gonna try to chase my finger around, okay? Perfect. All right, that all looks really good. We're gonna go ahead and move on. I'm gonna check your reflexes, okay? So I'm going to have you put your hand up like that. Perfect. Now we're gonna have you relax it. Okay. Good. Oh, well, I guess we'll check this one too. Now that was your bicep. We're gonna check your tricep. Just relax your arm. Feel anything?
I do, I feel it.
Cool. Right there. Okay. And now we're gonna do the same with this one. Okay, just relax. Alright. Relaxed.
I can feel that.
Good.
A little
Good,
zing.
good. A little zing on the arm. Alright, we're gonna do down here, your patellar. Alright. Good. Next. Ah! That one was really active. Alright, now we're gonna do your Achilles. So just back here. Oh, good. Good. Alright. That all looks good. Now I'm gonna do a little test on your toes. So I'm going to bring this against my hand. It's gonna vibrate. I'm gonna put the foot of it on your toe, and you close your eyes and let me know when it feels like it stopped vibrating. Okay. You feel it?
Uh-huh. Now.
Alright, good. And then on my test, I'm going to, so this is your toe being up, this is down. I'm going to have you close your eyes and let me know which way your toe is facing, okay?
Down. Up. Up. Down. Up. Down.
Alright, good. Now, while I have this little handy thing out here, I'm going to do one more thing. I'm going to just, I skipped something on your hearing, so I'm going to go back and do that. We're going to do the Renee Weber test. So I'm going to hit this, I'm going to put it to the back of your, to the bone behind your ear.
Okay.
And you tell me when you stop hearing it vibrate or stop hearing the sound.
Okay.
And then we're going to move it in front of your ear and you tell me if you still hear it, okay?
Okay.
And then after that, we're going to move to the top of your head and you let me know if you can hear it in both ears or one over the other, okay?
Okay. Now.
Can you hear it?
I can.
Mm-hmm.
Now. Yes.
And then,
I hear it in both.
cool, perfect. Alrighty, to finish off, I'm gonna go ahead and perform a series of tests. Actually, you can use that step on down. And I'm gonna have you stand straight. I'm gonna have you close your eyes and don't let me sway you, okay? Alright, good. Now open your eyes. Put your hands up front in front of you. Now close your eyes. Alright. Good. All right, next up, I'm gonna have you walk towards that wall on your tippy toes. Good, and now walk back on your heels. Good job. And now go back to the wall with your heel to toe. Oh, come on back. I'm not trying to send you to a corner. All right, perfect. I think we are done.
Okay.
Excellent.